So I'm so excited to have Professor Ray Dorsey, who's a friend of mine. He is a professor at the University of Rochester and an author and an amazing advocate. And we are excited to talk about the national plan to end Parkinson's Disease Act that just got passed in Congress in the United States. So Ray, welcome to our segment here. And just wanted you to maybe tell us a little bit about this act, and then we'll also talk about your book that you've written there, because I think it has something to do with all of this ties together.
Delighted to be with you, Indu. So maybe I'll start with the book. So 4 years ago, my colleagues, including Dr. Todd Scher, who used to be the CEO of the Michael J. Fox Foundation and still there, Dr. Michael Oken at the University of Florida, and Dr. Bas Bloom at Radboud University, we wrote this book called Ending Parkinson's Disease, in which we outline a prescription for action to hopefully prevent and end what is the world's fastest growing brain disease. And then in Congress this year, with large help from the Michael J. Fox Foundation, especially Ted Thompson, their director of policy, introduced a bill that would require the federal government for the first time to develop a plan to both prevent and end Parkinson's disease.
That's so amazing. So, I mean, this sounds like big words, and it sounds like a very, important achievement, since it's hard to pass. For those of you out there not in the US, getting Congress to agree on anything in this day and age is actually really an act of God. So I think, the fact that they were able to agree on this at all and to make this somewhat of a priority sounds exciting. So what does this actually mean for us, Ray, as neurologists? Like, what do you see as the next steps, and what do you see this translating as?
So first, it passed. It was introduced into the House, passed the House 407-9. We should recognize Congressman Gus Bilirakis from Florida, who's been a longtime champion and chairs the Parkinson's Congressional Caucus, and Congresswoman Jennifer Wexton, who actually has progressive supranuclear palsy and disclosed that to the public this year. The bill is named after both of those champions in the House. And then last week unanimously passed the U.S. Senate. So what does the bill do? The bill requires the Secretary of Health to form an advisory committee consisting of both federal employees, like from NIH, the FDA, and non-federal employees, including people with Parkinson's disease, Parkinson's specialists, researchers, and others, to come up with a set of recommendations for the federal government to both prevent, treat, and care for people with the disease. What it doesn't do is change anything in terms of funding. So maybe that's why it was able to pass so readily. The bill, of course, still needs to be signed, the president, to become law. But there's no funding tied to it, but it does organize and hopefully activate the national government, federal government, to come up with ideas to both prevent and end this terrible disease.
So you've been hugely a big advocate in this space, and I know the book itself has been so, I think, transformational, really, as a call to action that is very sort of low-hanging fruit in some ways to change, what we think is causing Parkinson's today. And also, you mentioned things around global issues in Parkinson's, including issues in Africa. Maybe we could take a minute, since I have you here, Ray, and that is not easy to sort of get time on your calendar, to maybe just outline for our viewers out there, the members of the Movement Disorder Society, which is, an international group of really the who's who and leaders in our field, as to what we can really do, what we can do as neurologists individually, and also what you hope to accomplish through this work.
I think we need to change the way we view Parkinson's disease. Parkinson's disease is fundamentally preventable. Parkinson's is a preventable disease, and we need to approach it as such. We've known for over a century that only about 15% of people have a family history of the disease. That's been replicated by scores of studies since then. We know today that if you sample 100 people with Parkinson's, only about 15% of people carry a genetic risk factor. We know that that even the causative genes, that only one Parkin, which accounts for 1% of people with Parkinson's, is fully penetrant. We know that other mutations like FLR2, 2-3% of the population, is only about 40% penetrant. GBA, which is the most common genetic risk factor, is only 10% penetrant. So we know that even among the small minority of people with a genetic risk factor, 15%, that in most cases, the genetic risk factor is insufficient to cause the disease. Dr. Caroline Tanner from UC San Francisco has been quietly and politely telling us for a generation that Parkinson's disease is predominantly due to environmental factors. In the US, I think the predominant ones are certain pesticides, dry cleaning chemicals like trichloroethylene or TCE, which contaminate the marine base Camp Lejeune, led Marines there to have a 70% increased risk of developing Parkinson's, and air pollution. So if Parkinson's is preventable, we need to start investing in preventing the disease. Right now, only 2 cents out of every Parkinson's research dollar is devoted to preventing the disease. Only 2 cents out of every research dollar. We need to fundamentally increase the amount of money we spend on research aimed at preventing the disease. And more importantly, we need to make our voices heard. We know what are at least risk factors of disease. I think it's almost impossible to say that certain pesticides like paraquat are not at least a risk factor, if not a cause of the disease. I think it's really hard to argue increasingly that these dry cleaning chemicals like trichloroethylene and perchloroethylene are not a risk factor, if not a cause of the disease. So we need to make our voices heard and work to ban these chemicals. Fortunately, in the United States, the EPA has proposed a ban on trichloroethylene and perchloroethylene. The EPA has banned chlorpyrifos, a pesticide that's estimated to cost 25 million kids in America 17 million IQ points. But the company its manufacturer sued, and now the courts have sent this decision back to the EPA. Those are just things that we can do in the US, and of course, there's much more to be done globally.
Wow. So these are pretty profound things. And it sounds like also the US has different standards than other countries as well. Maybe you could teach us just a minute on that.
Yeah, so it's really good. The U.S. is widely viewed as having some great regulations from the Food and Drug Administration around new drugs. So to introduce a new drug into the market, you need to show that it's both safe and effective. But that's not the case for chemicals. Right now, the burden of proof is on the public and on the EPA to prove that a chemical is harmful. We need to adopt a precautionary principle, much like they have in Europe, much like we do for drugs, that the chemicals need to be shown to be safe before they're entered into the market. If we did that, we would prevent chemicals like PFAS from causing cancer. We would prevent chemicals like TCE, known to cause cancer, from causing cancer. There are millions of people that we do not see today, because there are chemicals causing cancer and likely Parkinson's disease that resulted in millions of deaths. We should be very, very mindful of who we do not see and why those people we do not see are not here anymore. And the reason why some of those people aren't here anymore is because chemicals introduced into our environment that are harmful, that are known to cause cancer, are continued to be allowed to be used in the United States and around the world. And it's not just the United States. These chemicals like pesticides, use of pesticides has increased linearly since World War II, and they're increasingly used, and I think they have increasingly harmful effects on the public's health. So
the folks that are trying to keep these pesticides in use, could you just, this might seem like a very dumb question from I'm just a neurologist. Why are they able to kind of lobby like this? What is the, is there a financial incentive to keep, are they cheaper? What are we battling against here, Ray?
So I'm a neurologist too. So I think in politics, it's a game of power, right? That's what politics is. And it turns out that if you have a narrow, well-defined interest, sometimes that narrow, well-defined interest could be more powerful than a diffuse interest that's spread across lots and lots of people. So the manufacturer of Paraquat, according to The Guardian, makes $400 million a year from its global sales. If just 2%, by contrast, Medicare spends $25 billion of the U.S. Universal Health policy for people over 65. Medicare spends $25 billion a year caring for people with Parkinson's disease. If just 2% of Parkinson's disease in the U.S. were due to Paraquat, which is associated with the 150% increased risk of Parkinson's disease, that means taxpayers are spending $500 million a year caring for people with Parkinson's disease due to Paraquat, more than the company makes in revenue, not even profit, from their pesticide. You have to ask the manufacturers why they are continuing to use a weed killer that their own country, where the company's based, doesn't allow it to be produced. It's manufactured in England. England doesn't allow it to be used. but some reason England exports it to the United States, Brazil, and Mexico, and being sprayed on fields in upstate New York, likely today, and in California, where you are today as well.
Some of these statistics are pretty mind-blowing, and I think that I really admire the work that you guys have done, the book itself, and people can get it. We'll link it down here. But I read it, I think it was about 4 years ago, just as the pandemic was unrolling. So it's already been 4 years. I think some small changes have started to happen, but hopefully we can all work together as neurologists and movement disorder specialists and allied health professionals around the world to really raise awareness of the importance, I think, of environmental, risk factors and contributors. I think there is a focus on genetics as well, but I think that, we have to do this alongside. One last question, Ray, in your opinion, if you had been in Camp Lejeune and there's a sense that there's an increased risk of Parkinson's by a certain percentage. What was the percentage?
70%.
70%. So what would you do in your own life? Forget about what the data shows or, what we know in science to be, proven through, randomized control studies or evidence or whatever. What would you do to prevent the onset of Parkinson's disease?
So I think there's some individual actions that we can all do, and some things I've done since writing the book and doing the research and reading all of Dr. Carly Tanner's great work. So I buy organic. I wash all my fruits and vegetables, even the organic ones, with water and soap, basically a pesticide wash, because some of these pesticides are fat soluble. I put a carbon filter like from Pure or Brita onto my water supply at home to decrease my exposure to toxins. I exercise, I bike to work every day, and I wear a helmet when I do so. So I think those are all three easy things. I'm a vegetarian. Well, I don't eat meat. I think, there's studies show that a Mediterranean diet may lower your risk of developing Parkinson's. I tend to think it's not perhaps so much the fruits and vegetables, but not the toxins and pesticides that are concentrated as you go up the food chain. And so I think decreasing your consumption of processed foods and decreasing your consumption of meat, especially from questionable sources, are all things that we can do to lower risk of Parkinson's disease and to live healthier lives. One other point that you were just touching on, what should we be all doing as a community? I actually think it's our responsibility to take action to prevent Parkinson's disease. When COVID-19 happened, we looked to our colleagues in infectious diseases to figure out what was causing it and to develop vaccines for it and prevent it, right? They answered the bell. We need to answer the bell for Parkinson's disease. Is the world's fastest growing brain disease on our watch? I don't take any pride in that. I take shame in that. And I think we should be all reflecting, why is Parkinson's disease increasing, and why is it increasing on our watch? And why have we failed to take action to prevent it? And in general, brain diseases are the world's leading source of disability, the second leading cause of death on our watch. We're neurologists, as you indicated to it. We should be taking action. We should be held accountable to address these things, just like our colleagues in infectious disease did so with COVID-19, just as like they did for HIV. We have yet to answer that bell for Parkinson's disease, and millions of people are suffering it because of it.
I couldn't agree with you more. Well, this has been so exciting. I would just add a couple of other things that maybe, could help prevent it. I think, social connection is important. I think we see that people who are disconnected and lonely have an increased risk of getting Parkinson's and dementia. And sleep, I think sleeping well at night is important, and perhaps even, some sort of way to disconnect from all of our devices and, some maybe, stillness in our lives. But I totally agree with you on these approaches. And I think we need to be thinking not just about treating symptoms at the, sort of after the cat's way out of the bag, but I think we need to be thinking about, if not primary prevention, at least secondary prevention from some of these,
This is preventable. This is primarily preventable. We need to wake up and stop trying to cure a preventable disease and start preventing it.
Awesome. Okay, well, on that note, Ray, I will let you get back to go back out there and do that. Thanks for taking the time with me. I appreciate it.
Many thanks, and do. Bye-bye.